This exercise is standing hip shifts. So you're gonna need something between your knees. So I have a foam roller. You can also use a ball. If you don't have a foam roller or a ball at home, like a small kid's ball or a Pilates ball works well. If you don't have either of those, you can also maybe just grab a pillow or a rolled up towel, or even a toilet paper roll is actually a pretty good size for this as well. And so you just want to hold on to something. You're going to kind of bend your knees slightly, sit back, kind of hinge at your hips. So you want to keep a neutral spine. I don't want you excessively arched or tucked and rounded. So somewhere in between, hold on to something that gives you support. So something sturdy, a countertop, a banister, or if you have a basement, a pole like this works well too. And you're going to slightly squeeze what's between your knees as you shift one knee forward and one knee straight back. And you should feel an opening in the back of your hip when you do this. And you can just kind of breathe normally. Just make sure you're not holding your breath. Inhale through your nose, out through your mouth. Just shifting one knee forward as the other knee comes straight back, and feeling that opening in the back of the hip and glute. What I don't want to see is sometimes people will hike that hip rather than shifting that hip back. Basically what we're thinking about is shifting our femur, our thigh bone, back in the socket, and that's why we feel that opening in the back of the hip and glute. So we're going to alternate sides and just breathing normally, shifting and making sure you're gently squeezing the object between your knees kind of the whole time. That squeeze of something between your knees helps us kind of get that good hip shift. So there should not be pain with this. It should just be an opening or release in the back of the